This is called the SI model for infectious disease. So basically what this is a very simple model to see what's going on with infectious disease in a population. So I'm getting some questions around when this peaks out, and the question is really, what are you meaning by peak? What peak, right? So basically what all this model is saying is there's only, you're one of four categories. There's only susceptible people, infectious people, recovered people, or dead, right? That adds up to the entire population of what you're modelling. So the entire population of Australia is either a susceptible, an infected, a recovered, or deceased, right? So that equals the total. So you have some number here, and that will always equal the total of all the top numbers over here. So you start off, everyone's susceptible, no one infected, or very few people infected. Then you move to the other side. You can see that graphically over here. So you've got like starting off t equals 0 down here, 25 million susceptible people, and then sometime later you end up wherever, depending on some factors I'll get into in a second. You'll move into the susceptible drops down to the crowd immunity level. And meanwhile, recovered people increase and everyone ends up recovered over there, okay? And the difference between where we were before was susceptible and over here, recovered, is people who are deceased at the end of it. And then you can start playing around some variables to see how that pans out, right? So this is the model, and then you can start experimenting to see how things are, how things sort of progress. So you can experiment with some numbers. So I've put some numbers here. There's some maxes over here, amounts over here, so which the peak. So here we have this curve over here is infected people. This is currently in the, if you say these are buckets, a bucket which susceptible, recovered, infected. So if you let this disease just sweep through Australia, given the numbers we know, it will peak at some date. This is just a model, again, that if you did nothing pretty much, you'll end up with infected of 8 million people at the same time, June 15, given the rate of spread of 0.022 was what was happening earlier. So I've just standardized that rate. So that's what you've seen down here. I've just got 0.22. But as you've seen, the rate is all over the place. It sort of does this dance across, right? So you're creating an average line. At the moment, I've said that it's around the 20s on average, even though we're seeing it's down here now. So just for the sake of argument, this is the difficulty of predicting this rate, right? So if you go over here, this is the simultaneously infected people. Let's start playing around with this. All right. So if you say the rate, because of social measures, drops down to 0.15, we can see what that does. So we can see that recalculate, and now you've gone that the peak is now more to the end of the year, and it's only 5 million people that are simultaneously infected, right? And if we lower the rate even further to 0.11, we'll flatten that right out. Simultaneously, January next year, the maximum infected people, right? At the moment, all the statistics are talking about at the moment is cases, right? So if you want to put case data here, which is this column, Q, let's add that, Q data. All right, where's cases max out? So this is the amount of cases. That's how cases progress over time. That's his total amount of infected and recovered people and dead people at any one time, right? Which is basically this slide. Let's remove that now. So you can see that the maximum amount of dead also depends on the mortality rate. So in this model, I've got the mortality rate as 0.02, but it's really less than that now, so I can really probably call it 0.01. And you can see the maximum dead in this model is 469,000 in Australia, which is the black line over here. But if you change the rate of spread, like if you go back to what it was, you watch this jump up massively, dead. So what I've got here, this is the maximum number of infected people at any one time needing hospital, needing ICU. Now when these numbers trip over the edge, what I do in this model is what I say is there's a critical factor. So while you've got access to beds, the mortality is 1%, but when you no longer, so ICU first, it goes to a 2, so it doubles the rate of mortality. And if there's no beds in both hospital and ICU, I go into a 3. So this is making an assumption it's 3 times more deaths than the baseline if there's no access to hospital. Right? And these bed limits are going up to the projected beds and ICU beds that Australia have promised. At the moment, you can see here they're around 60,000 beds and 2,400, but that will go up to 90,000 beds. So it depends if we get to the bed necessity fast, hit that limits, we could end up in a situation like here where you need a hospital bed, you need an ICU bed, and you're not going to get it. And I've made a very modest assumption, and you're getting these crazy numbers because people aren't getting access to the hospital and the mortality goes up during simultaneous infections to some big numbers, right? And again, this is just a model, right? But just interesting to see the effects of these social distancing. So this is why it's so important to have these social distancing measures to flatten out this curve here. So again, we're getting it down. The numbers at the moment are really quite low. Let's put it to 9. Okay, that'll takes a second. Yeah, it's pushing it right out. Now the problem when you see this here is numbers like this, the current rate of infections, it really draws out. It's the susceptible people. It takes a long time for the crowd immunity. Like this is off the graph already, right? This is April 2021, and susceptible people, you've only got, infected. You've only had a peak infections of not even 1 million people, right? Now, that's what it looks like if we maintain measures, but the dead limit goes massively down. The other numbers here which are important, let's go back. I'll show one more thing before we finish up. Let's just put a number back so we can see what we're dealing with at the moment. So back to this. This one is the recovery. So the average cases are 15 days. So the longer that is, or the shorter that is, makes a big difference. So if I put that in as 0.05, right, that means that it's 20 days. This is pretty much that you can't change this. The recovery takes 20 days. You get a higher peak because you got longer infectious periods. So it increases the rate. So the peak infections now become 10 million. If you come up with some drug that lowers the infectious period, maybe make it something like this, right, where it's 11 days, it makes a big difference on the infectiousness. So the peak infections now, because they've dropped them down from 15 days to 11 days, makes huge differences on the concurrent infected people. So drugs could come up to affect this number, right? That would be not vaccines, but antivirals that lower your infectious period. So that is probably a better bet than a vaccine coming out. So this model is just a tool for gauging certain numbers and outcomes, and see the tolerances and what we call correlations between one number and another. So hope this has been informative to you and sort of gives some background understanding of what's going on at the moment.